To order, it's 2:00. Winnebago County Community Mental Health Board meeting on Wednesday. What's the date today? It's October 2nd, 2024, 2:00 p.m. I will begin with the roll call. So here we go. Mary Ann Abadi, present. Andrell Ragshaw, present. Dr. Copeland.
Present.
Dr. Giardini.
Here.
Dr. Forresty.
Here.
Dick Cooner.
Here.
Margie Lindmark. Present. Tim Neighbors. Jeff Nielsen.
Here.
Mohammed Yunus.
Yeah.
And welcome visitors, and Jason, our director, and Nicole is here with us today, and we have two of the other staff from Region 1. So thank you all for being here. Moving on to the next order of business is public comment. And we have quite a few people signed up for public comment today. Probably broke our record. So just kind of rules of the road. The first person speaking will be allowed 3 minutes. Anyone speaking will be allowed 3 minutes. But if the people that are next in line to speak on the same topic, we ask that you just step up to the microphone and support the first person, or you can oppose. But we don't want to sit here for 8 individuals to have the same comments about the same concern. So that's what we allow during public comment. So I don't know exactly how many people tend to speak on the same topic, but I will allow, Kiefer is here, I think a group of you to support. And so the first person, please step up. You can use the podium, or if you're comfortable.
That's the order that they received.
Okay, the order, and we do have an order here. It's Keshonda Williamson is the first person to speak. Right up here.
Good afternoon, members of the board. My name is Keshonda, and I am one of the co-founders of KK. For me, this isn't just an institution or a mentorship program. This is my life's mission. KK represents everything that I believe in. Giving back to my community, supporting mental health, and empowering young people to overcome their challenges and thrive. Mental health support and mentorship isn't just a concept we talk about at KK. It's the lifeblood of what we do every single day. I've seen firsthand how mental health support and mentorship can transform a child's life. How it can be the difference between someone falling through the cracks or finding their strength. The children who come through our doors aren't just students, they are our future. And we have the responsibility to guide them, to support them, to believe in them when they don't believe in themselves. KK is rooted right here in Rockville, Illinois, Winnebago County. This is where we make the biggest impact. This community is our home, and I want to see it thrive. Mental health, especially for our youth, is a critical issue. And through our mentorship program, we are addressing that issue head on. I'm here today because I believe the program that our community, with this program, our community will be stronger, healthier, and more united. It's not just about what we already accomplished, it's about what we will do together with your support. We are asking you to approve KA's funding request for the mentorship for mental health and wellness program, so that we can continue this work, so that we can expand our reach and ensure that no child has to go without guidance and the mental health support that they deserve. Together, we can make a difference, starting right here in Winnebago County, with your support of our mental health and wellness program. Thank you for your time and consideration.
Thank you. The second person is Stephanie Wells.
My name is Stephanie Wilson, and I am the guardian of 3 young ladies that attend KEM. 2 that are my great nieces and 1 that is my granddaughter. I stand here today not just as their caregiver, but as someone who has witnessed firsthand the incredible impact that mentorship at KEM has done for my girls. The girls have been through unimaginable trauma. And with the experience that they have, the things that they have experienced at KEA, when they first came to my care, it was the struggle and everything that they've been through. So when KEA and its mentorship program came into our lives, I cannot emphasize enough how transformative it has been for them. The mental health support and mentorship they receive at this institution has provided not only academic support, but also emotional guidance and that they desperately need. KEA has helped my girls find hope again, helping them to process their trauma and navigate their emotions and regain confidence in themselves. I've seen my girls transform from being withdrawn and overwhelmed to becoming more confident, open, and resilient. KEA has truly been a life-saving for them. And it's not just for my girls, it's countless other children who benefit from this kind of support. They need mental health support and mentors who understand what they are going through and can walk alongside them on their journey of healing. I'm asking you today to support KEA's mentorship for mental health and wellness program because it's more than just a mental health support and mentorship. It's a lifeline for children like mine and families like mine. KEA is providing these kids a chance to heal, to grow, and to build a brighter future. Thank you for your time and your consideration.
Okay, the next person is Samya McDavid. I'm mispronouncing the name, I'm sure. Samya. And just so I know, is this a continuation to support us funding the program?
Yes, it's a continuation of why you should support KA.
Okay, well, here, that's the topic that we said, once the point is made, if you want to just say a brief sentence and then, supporting the program rather than going through everyone just, because we don't usually have this happen when we have this many people. And the full board hasn't even reviewed the program yet. So, can you summarize what you're going to say quickly? Okay, thank you so much.
So my name is Samaya.
Samaya.
I'm 14, and I've been going to KA since I was about 5th grade. Going to KA has, first of all, allowed me to go 2 grades ahead of my academic level. So currently I'm doing 10th, 11th grade work, and I'm supposed to be a freshman. And also being in KA has helped me meet a lot of people who have opened a lot of doors for me, and it's helped me grow as a person. Like, we have people come in and talk to us about life experiences and what they've gone through in their life, and it's helped me a lot to realize, okay, well, I look up to this person now because I want to do something that they did, or I want to be somebody like who they are, and it just helped me grow and open myself a lot as a person. And also we've had therapists come in who have helped us, like, if you're feeling this way, this is something you can do. So also speaking to therapists and understanding how to process what I've been through in my life and what might happen to me in the future has also helped a lot. So I just hope we can keep having people come into the school and talk to us, and also any other things that the program might provide.
Thank you so much for sharing. Okay, the next person is Gerald Grimes. Is that correct?
Gerard.
Gerard, I'm so sorry.
And I'm with the close of everyone up here to make sure too. I just wanted to introduce myself. My name is Gerard. My grandson goes to KPA, and with the mentorship that's done with him, he's a shy, passionate. We ended the program, and now I've seen 180 return. He's raising his hand, he's more out there, and that's all the encouragement of the staff and the students at KDA. And I would like for you guys to consider it for the
Thank you. Okay, Asher Roach.
Hi, it's Aisha Roach. So I am the proud mother of 2 children that goes to KEA. My daughter named Kaylee Valentine, age 11, turning 12, and my son Malik Roach, 7, turning 8. Interesting story. My husband and I owned a home in Dixon, Illinois. I'm sure everyone's familiar with Dixon. And my daughter, and my son was in preschool, but my daughter was experiencing different things, going to a school, where she was trying to navigate through her ADHD, etc. Long story short, my husband and I decided, that we tried everything, very, very smart, but still we're dealing with some issues. So we tried everything. We decided to sell our home, after talking, to the CEOs of KDA. We decided to sell our home, and purchase a home here in Rockford. I am, again, a mother of 2. I work for Zillow. My husband, is a contractor and a, ASM mechanic. He also is a mechanic at Kentucky Auto, and currently, we have just bought land to purchase for him to build, his own auto shop. And I say all of this because my children we're actually dealing with something, what I would consider an identity crisis, being able to talk to and work with and look up to people in the community who look like them. So I believe that being at Kia has helped them so much. My daughter, she's actually very well known in the community. She is brilliant. She's 11. Again, she's turning 12. She is now employed as an employee at for Disney Channel. She goes there twice a year. She's continuously in training. She actually sings as well. She travels all over. My son is on a football team that travels all over. And these are all things that happen because we have the mentorship and the guidance of wonderful people like the people at KEA. On top of that, he's excelling. He knows his plan in life. He knows where he wants to go. He knows that he wants to be an astronaut. He knows that his first step is to be an engineer in order to get there. These are not things, a little shameful of that, but these are not things that I taught to him. These are things that he comes home and tells me from the mentorship and guidance. So continuous health and wellness and mental health for dealing with different things and different people in the community, I believe will be great at KEA. I'm super excited that you guys gave us this opportunity, and I know that it's a lot of us, but please understand that we're here and all of us have came out because we are truly passionate, and mothers like myself are truly committed to seeing their future, their kids succeed, and this program will help us tremendously. Thank you.
Anita Weiland.
Thank you. I'll make it short too. I'm in kindergarten. I started as a volunteer, but I will talk about my granddaughter. She was the first graduate at Kiefer's Entrepreneurial Academy, and there was a time that I had to watch her go through a very rough time as a teenager, but with the guidance, it was a traumatic time for her. Teenage girl, go through a lot. But being at KEA helped her. Sorry. It helped her get through a lot. KEA was there for her at the time that she needed it the most. And I know without their support, she wouldn't be where she is today. She's graduated from KEA, she's in school, she bought her first car, she's in a program with our police department, because her needs to legal, investigate crime scenes, and she knows she has to start at the bottom. But I know that without KEA, she. So I'm really hoping that you will support us.
Thank you. Okay, Maria Willis Hunt. That person, oh yeah, right there.
I'm sorry, what was the name?
It's TAHRVA is the first name,
What was the last name?
Brown.
Hello, my name is Tanaya. I am 14 years old and I live in when I first came to Keep Crews, I was lost and unsure of myself. And I'm carrying everything that I have been through. Because I went through foster care and that's like, no people.
You don't have to be scared at all, but we know you support this program. It's all right if she doesn't speak today too.
This is my greatness. This is one of the children that I care for on a Winnebago. I care for almost 3 years now, and she's been through a lot, When she went into KEA, she was very much under her grade level, but with the support from the staff, principal, myself, she's where she should be today. And what she's been through has been a lot, taken on a lot mentally. She's got 2 siblings under her that she practically cared for prior, and now with help, she's grown quite a bit. Because it was rough, but like I said, between the staff and myself at Cuba, she's got it. She don't just feel at 14. She is 14. She gets to be 14, It used to be a time where they never went anywhere or did anything. But I don't believe that they stuck on me all that, So I get the mountain. And with KEA, there's always something going on, not only education-wise, but they get to learn. And they get to talk to people and explain to them what I'm going through. Can you guide me this way, or what should I do, and, things like that. So
Thank you.
and I appreciate her not being very good.
Okay, Al Walker.
Just Albert Walker, I'm sorry.
Yes, Walker.
Hello, everyone. I want to thank you all for having the opportunity for us to be able to talk about KEA. Appreciate your patience. I am a lifelong resident of Rockford, Illinois, and I've seen the things that have come about from mental health here. And so it's really good to know that Winnebago County is still involved in mental health in the city of Rockford. As a lifelong member of Rockford, we always hear about mental health. Mental health includes our emotional, psychological, and social well-being. It affects how we think, how we act, and how we treat others. And it helps us to make healthy choices. I have a granddaughter 7, and 4 of my children are at KEA. 4th one, she was not able to attend this year, so I can show you some of the with KE, they allow the children to get to know themselves. They allow the children to be able to, they train them how to become entrepreneurs. The children have published books, and that's just the curriculum. They teach them how to interact with each other. At their current location, it's an excellent place for them to be because they're actually walking around, figuring out places here, going to the library, going here and there, and actually meeting with people in their library. So that helps children learn how to talk with people who don't look like them, speak with people who don't look like them, and it works out because we are all in this together. Because all of us need to be able to communicate with one another. And the thing about it is this with KEA, with the training that the children have reached, and with the ministry program that we're looking forward to be able to share with Rockford, that program can help cut down on many of the things that we're dealing with here in the city of Rockford. Whether you're Black, whether you're white, everybody is dealing with things in the city of Rockford. The mental health issues are especially an important one here in the city of Rockford. You can see different people from the singer episode, people were let out on the streets. And so all of us here probably have an opportunity, if you're in the downtown area at all, to be able to say, okay, this person may have an issue. This person may not have an issue. That person may have an issue. So what can we do about that? We can start programs that mentorship for our young children so that they can have an opportunity to do something different. In KEA's program, what they do, like I said, they build a confidence. They train them how to speak to one another, how to communicate. I mentioned that before. But the biggest thing is to be able to share that program with the city of Rockford. I've been here my whole life, luckily for me, but it's a very much needed program here in the city of Rockford. And I'm just going to say what happened with my 9-year-old granddaughter. This was her first year without being at KEA. She's been there since the COVID time. She was one of the COVID kindergartners that we didn't get a chance to go. So at KEA, from now to the 4th grade, she's at Rockford Public Elementary School. And I'm not putting down Rockford Public Elementary School, I was not put down for that, but there is a difference. The difference is that she's stating to us that she's doing 3rd grade work, the work that she did in 3rd grade. So it's not so much that, but that she also was dealing with a young man who was giving her attention, or unwanted attention. It was unwanted attention. And she said, the fact that she came to us and she talked about what was happening with her, it wasn't the silence, it wasn't the shutdown. She heard first in their program that if there's an issue, let's talk about it. Let's get it solved. So that's what the program has to offer. And it can
Thank you. It's over for you. Thank you so much. Yes. Okay, the final speaker is from Rosecrans, and it is Sadie Covio.
Good afternoon, my name is Sadie Covio. I work for Rosecrans Behavioral Health here in Rockford. I wanted to take a minute and just say thank you so much for your continued efforts to increase behavioral health services. In a county we all know continues to need that support. With the funding from the Mental Health Board for our individuals at our Rosecrans Harrison location, which is specific to withdrawal management and detoxification, we've continued and been able to make such a significant impact for individuals in our community. Last year, our goal was to serve 200 people, and we surpassed that goal, serving 390 individuals. And want to continue to do so. So far this program year, we've had the opportunity to serve 150 individuals, and we're looking forward for the opportunity to continue to serve more as it's a needed area here. I just wanted to pop in and say thank you and share that quick update. We're super excited that this has given us the opportunity to continue to serve these individuals and support them on their journey of recovery, whatever that looks like for them. Thank you.
Thank you. Thank you all. Okay, moving on to the monthly activity report.
Thank you. I will also be brief, and I would like to acknowledge something that I haven't released in the press release yet, but we have a number of press here, so I guess I'm releasing it now. We have been named as honorable mention Grant Maker of the Year by the National Grant Professionals Association. This was a process in which we were nominated a couple of months ago, and we made it to be a finalist and went through an interview round. They selected 2 awards, which they do every year, and then they name some additional honorable mention. So we were up there with some pretty high-level top grant makers in the country. 4 years into our program, and got some really great feedback from some people who have been doing grant making for a long time. So just wanted to highlight that, and we'll issue a press release very shortly. And then secondly, up and coming on Friday, we will have completed our 2nd Accelerator Award. We haven't finished awarding all of them yet, but we've got 2 that are done. This one will be the Summit Soar Academy playground that was funded by the board that is now completed. They're doing their ribbon cutting ceremony, correct, on Friday. And if you are interested to attend, it is my understanding that all board members were sent that information through your official board email account. But if you did not get that and you wish to attend, please let me know. I can forward you any details on that Friday at 3 o'clock.
Okay, thank you, Jason. Moving into action items, I'm going to need a motion to approve the September 2024 meeting minutes.
So moved.
Mohammed moved.
Second.
Included the second. Thank you. All in favor of approval? Please say aye. Opposed, same sign. Okay. Moving to our second action item, the program year 2024 to 2026 special conditions map. Jason, do you want to summarize a little bit?
Nicole, anything you want to say about this? We have the information present for you and the numbers from the organization.
So we will need approval, so I'll need a motion for approval of the conditions being met. Okay, Dr. Jardine, and second. Okay, Mohammed, and any discussion? Okay, hearing none. This one can be not with the roll call, correct, for the special conditions? Yes, okay. All right, so all those in favor of program year 4 to 6, special conditions being met, please say aye. Aye. Opposed, same sign. All right, resolution 2024 X, resolution that authorizes the Winnebago County Community Mental Health Board funding and allocation for special project funds for Accelerator Award. And I have to get to this particular resolution. It's here. Okay. Winnebago County Mental Health Board shall fund the following proposals after review of the application. The Regional Office of Education, well, the amount is $750,000 for the student support interventionist. For the Rockford Area Arts Council, Spark at Washington Park, the allotted amount is $206,800. And the Arts Council, the Arts Council will provide a detailed budget, and the funds will not be used to hire permanent staffing. So those are the agreed upon conditions. So I need a motion for approval for this funding. Okay, Dick and Jeff, okay. So any discussion, questions? Okay, this one, we will do a roll call for that. Okay, Mary Ann Abadi, yes. Andrell Bradshaw.
Yes.
Dr. Copeland,
Yes.
Dr. Giardini,
Yes.
Dr. Gorski,
Yes.
Dick Hunter,
Yes.
Margie Lindmark,
Yes.
Tim Neighbors, Jeff Nielsen,
Yes.
and Mohammed Yunus.
Yes.
Okay. So, we can then move on to the next resolution, number 2024-XX. This resolution authorizes Winnebago County Community Mental Health Board Accelerator Awards preliminary review determination for applications received. So it has been decided that Crusader Community Health program named Crusader New Behavioral Health Access Point will, the Winnebago County Board, the Mental Health Board is willing to evaluate and score these particular programs. The ineligible for review is the Tommy Coral Memorial Foundation program named Community Mental Health First Aid Training. And it was ineligible for review because the request does not align with our strategic plan and there is no value added in perpetuity. Oh, and this one, I'm so sorry, the most important with the people here. The Kiefer Entrepreneurial Academy mentorship for mental health and wellness was approved and the board is willing to evaluate and score. So those two will be going through for review. So, that's where we stand, but we do need an approval on the, we didn't do the, no, we need an approval for these two, yeah, okay, so I need a motion for approval, Bill, for Steve and Dick. All right, so again, I will take the roll. Yep.
Marianne, what will be the timing of these coming forward?
I'm gonna defer to Mark on that. I was gonna mention that.
Sure, so with the ones that were funded, that will go through the regular process, we'll have a meeting. With the ones that are under preliminary review, we'll be opening that up to all the board members for review pretty soon. I would either say this afternoon or tomorrow.
Okay, so thank you.
Yep.
Yeah. Okay. Any other questions? No, hearing none. All right, so, Marietta Body, yes. Andrell Bradshaw,
Yes.
Dr. Copeland,
Yes.
Dr. Giardini,
Yes.
Dr. Gorski,
Yes.
Dick Hunter,
Yes.
Margie Lindmark,
Yes.
Tim Neighbors, Jeff Nielsen,
Yes.
Mohammed Yunus.
Yes.
So, it's passed. Okay. Moving to the next agenda item is, board, the 2025 board meeting calendar.
Yeah.
So,
The reason I'm putting this before the board is because we have meetings scheduled for the first Wednesday of every month, and I post the full calendar for the year. As I was looking ahead, I noticed that January 1st was the first Wednesday in January. Personally, I would love to spend New Year's Day with all of you. I'm not sure how you feel about that. So I'm putting forth a meeting calendar that has January as the second Wednesday, which would be January 8th. Since that does deviate from our normal cadence, we will take a board vote on that, and if you approve that, we will post that on the website for 2025.
okay, so we will need a motion.
Motion to approve.
Jeff?
Second.
Okay, all right. So hearing any concerns or none heard?
Wow, it's like Rose Bowl, and I hope you want to spend it here.
I don't think so. Okay, so all those in favor of the new calendar, please say aye.
Aye.
Opposed, same sign. Okay, thank you very much. And discussion items, we have one, and that's a core program update presentation, and that's Jason.
So I'm excited to let you know that we have finished our financial reviews and outcome reviews from all of the programs that were funded for program year 24. Let's just call it program year 3, okay, it was the third year of grants. That ended in May. We have all of that data aggregated now and reported, so we're gonna go through some of that for you today. We finished our end year report, which will be published on the website, but wanted to give you kind of a custom presentation with some of that information, unless you ask any questions. And then I wanna kind of highlight for you where we think we can go moving forward with how we keep track and disseminate that outcomes information to you, so it's actually a little bit quicker and more readily available. And with that, I'm going to actually turn it over to Nicole, who has put together a presentation. And I will do.
Okay, will you be in the picture?
I'll be your screen share.
Good afternoon. For anyone that doesn't know me, my name is Nicole Bennett. I'm a licensed clinical social worker, and I provide support to the mental health board through being grant manager. So one of the large functions is interacting with all of the funded programs and then their outcomes. So next slide, please. Next slide.
You started.
Okay, so we're gonna just go over some few items, and if anybody wants this presentation later, we can provide it to you, so don't feel like you have to take a lot of notes unless you wanna take notes, and then that's lovely, you can do so. Last program year, we had 44 funded programs. 30 of those were programs that were renewed from program year 23 or second program year, and then 14 of those programs were new. Of these 44 programs, there were 291 unique outcomes provided by organizations. So when the program year starts, we meet with every single organization individually and talk about kind of what's their overarching goals that they want to accomplish, and we make those in kind of actionable outcomes that they can report to all of you. There were proposed 165 full-time equivalent positions, and then we have some funding slides later. And on average, there were 6,065 individuals served, and we'll get into that more later too. So funding spent, you can see here that 82% of the funding was allocated. And there's more discussion that we can have about that too, but 16.4 million was distributed out of the 20 million that was awarded. And you can see month by month the percentage that went up over time.
And just to quickly add to that, we budget for 90% because it's expenditure reimbursement. We know it's never going to be 100. So that's just an 8% difference compared to the second program year. We were at 66% of funds spent. So this is a significant increase of program scale and reaching capacities. It's very, very good.
And just for kind of context, on the first program year, there was about 68% that was allocated. Second program year, 72.6%, and so then half year, 82%. So really good progress over time. And then just as a comparison, so if you look at month 1, there was about 5% allocated in the first month, and then all the way by month 6, it's already up to 43%. So really good job meeting up their programming, because remember, 14 of the programs, some of them were granted. So, any questions about the slide?
Nicole, do you have a sense, this is a workforce question, do you have any sense of still unspent funds are related to inability to hire professionals or staff?
So one of our slides actually is about hiring, so
Okay.
hold your thoughts for 2 more slides. Okay, you can go on. Any other questions about this one? Okay, go ahead. So these are the numbers served. So when we talk about impact, these are actual individual humans served. So about, like I said, about on average 6,000 individuals served, and it's a 35% increase from last program year. And you can see here the largest target population that is served is individuals with serious mental illness. And then with our lower end, still quite a bit served, but those co-occurring category for 0 to 17. So looking at this, does anybody have any questions about? Yes.
So 6,000, what, for a year? Calendar year, like month, or what was that?
So, basic orders, like on average, orders about.
Okay.
Okay, so these are outcomes, so like we talked about, at the beginning of the program year, organizations, set out their outcomes, so some organizations who have been funded for multiple years, some of them challenged themselves to say, as was stated in public comment, what a goal was maybe one program year, maybe they surpassed that significantly, so then next year their goal is gonna be higher, or it's gonna be something different, or over time, organizations learn things that they can capture that they didn't realize they can capture, or things that they already completed, so maybe it's, build the program, next year, what are we doing since the program is built? So we have statuses every quarter that organizations provide to us, so whether outcome is not yet started, in progress, completed, or delayed. So that helps organizations communicate to us and know if we get an outcome report and no individuals were served, no money was spent, and everything says not yet started, we know that that's kind of a pilot stage. Or if a lot of outcomes are delayed, maybe we know that it's because of staffing, that's something that they're working on. And there's other areas in the outcome report where they can communicate that to us, it's called the redemptions tab. So it's a lot of qualitative fill-in information to explain really that they have conducted 100, let's say, right? And they're still having one more spot filled, whatever it is. But you can see over time how many more outcomes move throughout the process to either be in progress or completed, and a lot less delayed over time. So does anybody have any questions about this? And some outcomes, just as a, sorry, one thing to mention about this, some of the outcomes are in progress because it's something that they're always going to do. So provide mental health services to you. They're never going to not do that, so that's something that's always in progress. Maintaining full capacity for staffing, that's something that's always going to be in progress, and it's one that might be completed, somebody might leave, or there might be movement within the organization. So this is it. Okay, next slide. So Dr. Bergson, this is kind of what we were looking to. So in program year 23, we only had 40 full-time equivalent spots that were not filled. If fast forward to next year, you can kind of see this past program year. I'm sorry, you can see how many more.
Questions on staffing? We do have some positions have not been filled, so that's still going to account for some of that lack of spending. But we're getting way closer to full capacity from where we started 2-3 years ago.
That there's turnover, which would be normal.
It was COVID. We started, so hiring in seat clients was very difficult for agencies, so.
165 people. Service that's incredible. Change that's taken place in 4 years. So we really have changed with things. Student services within the county.
System of care, it's more about that's unbelievable.
Well, I'm not thinking this right now, but I imagine among the 165, you have a breakdown with specific professional certifications are necessary, or categories of profession?
Yep, so every organization has a work plan in detail what their work plan is, the personnel section, so it has every, if somebody is a licensed clinical social worker and point two is allocated to the grant, whatever it is, all of the breakdown from every organization.
When we aggregate them, which is the one that percolates to the top is the most difficult to find?
Would be a good study
Yeah, that is
for
a
us
great
to
question.
undertake. That would be a good study for us to undertake. We have not done that analysis yet. That's a good question.
Leave it to Dr. Preston.
Okay, so if no further questions, I will give some time to Seth.
So one of the, let me introduce Seth. I don't know how many of you know Seth. Seth is a data analyst on my team. He's been with us for over a year now and done some great work on a variety of projects. One of the challenges that we've had with the outcomes reporting is just the lag time from programs completing the report, giving it to us, for us to aggregate it all, put it into a report, graphic design report, put the report on the website. And so we wanted to do something partially based on board member feedback where we've said, how do I get this information easier access, quicker, more breakdowns by different program type. And so we've been working on a prototype data dashboard, which I think can replace our mid-year and year reports moving forward and have quicker information to you and more information to you. So we just want to show it to you today, get any feedback you might have. We'll probably do a soft rollout with different stakeholder groups over the next couple of months and get feedback from the funded organizations. And depending on what the feedback is, get something that's public facing, hopefully at the start of the year. I will go ahead and open this up. It's actually ready to queue up. So I'm wondering if this mouse and take the two of the.
Yeah.
Which are far over.
Yeah. So yes, the data team has been prototyping, developing a web application. So currently this is actually posted as a link here on the internet, so it's actually live on the internet. You can view it on desktop, laptop, mobile device. Mobile devices, especially on small screens, we've been working on some development for that, but it's been more or less successful. There's minor layout tweaks and everything, but eventually, everything you'll have, all of the information from the end of year report will essentially be at your fingertips here in the data dashboard. So first off, we have a home page. I'm not going to read through everything, but it just has information about the mental health board, target population, and what's included in the data dashboard. Eventually, we'd actually like to include a tutorial video as well for public users of what information they can access in the data dashboard. We'll probably redesign this top menu bar to be more of a side-based menu bar, allowing more space for the top nav bars to see. But right now, all the page links are here at the top, so you can navigate through different pages. Starting with the finances page. Should pop really in a second. There we go. You can see most of the same visuals from the end of year report, as well as the same thing in here too. The safety diagram is the one that shows the flow of money through programs and kind of where their what their kind of priority area is for that funding, whether it be like treatment, case management. So you can kind of interact and hover over it. You can actually download pictures as PNGs.
And all this is customizable, adjustable. This is one of the reasons we wanted to reach out for feedback to see what people would like to see in the data dashboard. One of the things I really wanted to show, both for the progress and outcomes one, is something that we haven't, I don't think, presented before, is really detailed information, not only on, for example, the outcome progress visual that you saw earlier, but also program-specific ones. So for example, if I were interested in Alignment Rockford's information, you can then see Alignment Rockford's specific breakdown, as well as their program descriptions, logos, at the end of the year, what their outcome status was. They had 4 completed, 1 like in progress. So you can do that for every single program. Select whoever you can search. I don't have my keyboard, but you can search for different programs. And then finally, you can do the same thing for the outcome metrics. So generally, we've been presenting information on number of clients served. For example, if you ever want to know the exact number, you can hover over it now and see. So for example, there was 5,939 clients served in Q4 for total clients. You can see the breakdown by the different target populations, the breakdown from your, typically this is the annual report of your ages of the clients, rates of clients, ethnicity, gender, and then a map with zip code. All these then you can download the PNGs for. And then this has the same functionality here where if I were interested in Brightpoint Doula, they're able to click on Brightpoint Doula, and then that would pull up Brightpoint Doula's specific, and then get a little bit of layout and the note, but basically you can pull up Brightpoint Doula's programs, information, and then you can kind of look at that. So it's all prototyping, being developing. It's mainly minor layout and getting it more mobile friendly, but that's generally the idea where it's at. So we're hoping for feedback and what people would like to see, because it's generally all possible.
That's incredible. Great.
It is.
Thanks,
Really
Chris.
broke it down.
Worked on it back there, and then Maria too. All
I mean, that's a level of transparency that, well, this is a set. I mean, that's 100% transparency about what it is we're doing and why we're trying to do it. So thank you very much.
Yes, no problem.
Thank you, Lord.
Excellent. Yep. All right, thank you, Jason. That was very informative. Okay, good job.
Are you saying this is online now?
Yeah, it's online now. You can look at, I said the mobile view, but it's a lot better if you turn your phone sideways, but we're working on some of the layout fixes for looking at it to be really nice on the mobile view. So you'll be able to look at it on your phone and on a desktop or laptop. So, and then basically the idea for having faster updates is we'll update, the data team will update essentially the outcome metrics when we get them. And then once we deploy them on the web application, that's when you'll be able to view those changes. So.
All right, one more thing.
Okay.
We need your feedback on one more thing. So don't leave that.
No.
You should do.
Hold your final motion.
Yes.
Okay. This is our.
Okay,
The level of sophistication with our data dashboard is incongruent with the level of sophistication with me. This afternoon.
so we wanted to, we've done a lot of research. Our team has about best practices for site visits, and so we've done them for 2 different years now. We've learned a lot of information. We've done a lot of data collection, what's evidence-based, and so we want to have a discussion with all of you about what your wants and needs are, what our ideas are. So feel free at any point to jump in. So we're gonna kind of just go slide by slide here. So for anybody who has not participated in site visit, the first year of site visits, we tried to, I think we almost successfully, except for one, visited every single funded program. Second year, we visited any program that was new or didn't get visited the year before. So, moving forward, all site visits would be eligible, all organizations would be eligible for a site visit. So, you can go next slide, please. So one of the key components of a site visit is a tour. So being able to go to the organization whenever possible, depending on what the nature of the organization is. Some of the visits we had to do early in the morning, so maybe survivors were not inside the building when we were there, or during the lunch hour or something like that. Other organizations, just when programming was that they wanted mental health board to be present, or whatever worked with them. So a tour and then meet with a program leader and program staff. Some organizations had board members from their organization present, like 25 people present, some had 2. And so we really want to make sure that we're giving organizations good structure to make sure that, the tour is included, people who interact with the program and individuals are present, and then different documents to review. So an organizational chart, so either if the program is funded in its entirety by mental health board, kind of everybody a part of that program, or if people want to provide their whole organizational chart and really explain how this program fits into the larger organization, that's something they can do too. Beneficiary data, so we're really talking about demographics or information that's not identifiable, not anything that would be confidential, but who is this organization serving? So all of that data that we talked about in Seth's show, but specifically for that organization. So where are people coming from, what zip codes, all those kinds of things. And then really sharing impact and success stories. So asking people who work on the program, kind of what are some things that are going well, what impact have they seen, what have they heard, and then any marketing or outreach materials. Some organizations were really great about this and already had things printed. Now that contract requirements have changed and organizations kind of have that as a part of their contract, all of them should have materials. So for all of you to be able to review those and look at brochures. So this is kind of the structure, and then we'll go through some kind of questions. But before we do that, does anybody have thoughts, questions about this? Anything about a site visit for anybody that hasn't attended one yet? Yes.
They have their information ready when you're coming, they know you're coming. When you see something that looks a little bit, you challenge them pretty hard, or how do you look at it and go, I'm not so sure about this, or how do you deal with it?
So traditionally how we structure the site visit is really for all of you to kind of go see and feel a program, right? So we can receive reports and all kinds of feedback from organizations, but for you to be able to go and interact with it, and to be honest, because I've been to visit every organization, and I think Jason's almost visited them all, if not more than once, we haven't had an instance where something like that has happened. So we do get all of their financials every month. We do get outcome reports. We have lengthy contract agreements that we have a lot of information already on organizations, and it's just nice to go see it in real life. So I don't know if Jason has something else to add, but to be honest, that's not been something that
I would say our general approach to compliance is to first try to help each program get compliant if there's a concern or issue. It's not a gotcha type of exercise, and generally that has worked. When the board was doing 1-year reviews on grant programs, concerns, we provide that information to the board. Of course, that becomes part of the funding decision. Moving forward, if we had a 3-year contract with the program and we had a compliance concern that was not able to be addressed through a proactive conversation and get the program to compliance, we would just have to bring that to the full board to determine if they thought that was something that required a firmer course of action.
Thank you.
Yeah.
Nicole, may I add, Jeff, just to add to this, I've been on a lot of these site visits. I challenge them. I mean, everybody has a success story, okay? That's great. But tell me what your non-success story is. That's where I find the integrity of the program, when they're willing to come forward, and then it makes for better rapport with that organization, in my opinion.
Well, yeah, answering the question, what are you worried about?
Yeah.
Mohammed?
If the site visit shows there is a major non-compliance, how there is an address?
if there was non-compliance found at the site visit specifically. Yeah, so I just want to be very clear, okay, because we are not set up to do to handle public, I should say, the PHI health information, that would be HIPAA. So we're not going through doing case file audits on these site visits. We're doing a meet and greet with the staff, looking at their program. So again, I mean, it would be the same that we'd handle any non-compliant issue, is just to direct that back to the program. Usually the things that we might find that are compliance issues are a lack of appropriate screening procedure to identify people with serious mental illness or emotional disturbances. And sometimes that's an education thing, because we have programs that are not traditional mental health providers who are trying to partner or bring mental health services to their location for the first time, and they just don't know what appropriate screening procedures are. So always try to start with the organization and course correct. Mary Ann often is brought in the loop on those, especially if there's a greater concern. And again, because the grants were one-year funding decisions, anyone that there was a non-resolvable concern with is not being funded anymore. Moving forward, if there's something that can't be resolved through a direct connection with the program, we will bring that to the full board. And you all can determine what is the appropriate course of action for that, including breach of contract as an extreme example of what the final decision could be if an agency is not able to get into compliance.
When they go for site visit, it has a standard checklist that they go by.
Standard checklist.
Yeah, so that's kind of something that's up to you. So we have some questions that we've identified to help get more information from organizations. So it could be something that's very structured. It can be more of a conversation. So some of the site visits, for example, it's just more of a conversation, some full presentation. So it's kind of up to you to have a discussion on kind of how you want it structured, and to make sure that that's communicated to organizations too, because some of them are very small, right? So to make sure that we're giving them ample time to be prepared, for all of you to visit them, within the amount of 3 of you to visit them. Yes, Terry, did you have something you wanted to say? No, Dr. Person?
Yeah, well, I was going to say for the new board members, these are really valuable visits. I think we all really enjoy them, get a lot out of them. I think the organization does too. I'm going to repeat myself. Nicole's heard me say this many times, and bless her heart, she now provides us with a little, I would say, a cheat sheet before we go. But to me, as a personal, it's been very important for the organization, because I think you mentioned in your first bullet point there about organizational chart for the program. Some of these programs do lots of different things. What we're funding is a very specific thing. I really want them, the opening comments, for them to specifically cite what it is we are doing for that organization. And rather than, I've been on some where it's the entire thing, it's the global scope of what they're doing, and it kind of gets lost a little bit in the shuffle. It's been better since Nicole started giving us the little one-pager to remind us of what we funded, so that's been helpful. But I really want to stress the organizations, when you deal with them, to come right out of the gate and say, thank you to your board. This is specifically what you have funded for us. With this, we've been able to do this. To Terry's point, I think he's absolutely spot on. What have you not been able to do? And if you haven't, why? What are the gaps or the barriers that you've experienced? That's when I think these things become really valuable.
Now they support their staff, and it's such a burden. You want to make sure they're supporting their staff.
Yeah, and there will be, and I apologize for an example, so like Dr. Gorski's saying, we're calling them report cards. They're not report cards, but it is a card that reports information to you, so I don't know what else to call it besides that. So it is a 1 page instead of a half page. Alex in the back here has made these lovely sheets for all of you, and they have feedback, specifically what Dr. Gorski saying, every single outcome that the program is working on written out for you, what the status of the outcome is, how many individuals are funded, so how many staff. So if they have 5 staff that's funded, it might say 3 out of 5, so you'll know that they have hired 3 of the 5 people that are to be hired, what their goals are, how much money has been allocated, all kinds of information, program descriptions, so when you go in, you have really good information to know about the programs, maybe it's one that's new to you. So you'll have all of that information in addition to time to ask them questions about, how is this outcome going, what are barriers, all those kinds of things. So if we go to the next slide, please, yes.
I would just like to comment. We have granted a lot of money. You saw the figure before, $59 million. I managed the grant program in Singer Mental Health Center for 15 years. This board and what we're doing with the processes that we have is more accountability than we could ever manage because of the computers, because of the IT kinds of things, but so we need people to understand. We give out a lot of money, but if they don't perform, they don't get the money. It's not a block grant that they simply get to keep. The other thing is what we're talking about now, the site visits and the interactions that the board is carrying on with the agency, again, is a level of accountability that with most grant programs, you do not see. And so, again, I mean, I think what we have given is a lot of quality money for services within the community, but equally so, this is the accountability that we have for the money is like, it's the edge of the arc. And I mean, again, that's why, you know, I'm sure we're getting honorable mention and a reward for our grant system is kind of like this, you folks are doing a great job. And our community really should. I wish we had more visibility and that people understood the quality of what this all represents.
And I think that organizations feel how serious site visits are and how serious the funding is and how they take it very serious. I feel when you come and the presentations that they do and the tours and how, I mean, everything is like immaculate when you get there, that they want to be sure that you are getting a great experience and you are, you know, really able to like see and feel, you know, kind of what they do every day and you feel the passion for the individuals that they serve. So, okay, a few questions. These are the subject types of the questions. So I'm just gonna read out some for examples. So these could be things that we talk about, right? So, what outcomes or impact have you achieved to date? How is the project benefiting the community or your target populations? Are you engaging stakeholders in any of your programming? Can you share any stories about the impact your project has had? Sharing your biggest challenges and how you've overcome them, if you have. If you have not, what would be helpful for you to do so? Do you have any plans for scaling or expanding the project? What impact has your facilities had on your ability to achieve project goals? And is there anything that we can do to improve our partnership? So in asking organization level questions or to leadership or however you want to phrase it, those would be kinds of questions that we would ask for leadership. On the other hand, you can go to the next slide, Jason. These would be more specific to staff. So if the directive from the mental health board is to have somebody that's a program level person, a part of the site visit, we could ask, you know, what is their role within the organization regarding the project? What are their day-to-day responsibilities for the program? How is it progressed on staff level from their perspective? How do they collaborate with other organizations or other service providers? And we kind of talk about, you know, are they involved with IRIS? Do they make referrals to other organizations? How well is that collaboration, that big system of care that we care about? What impact has the project had on the community? Can you share any specific success stories from your perspective? What challenges have you faced in your role? How do you engage within the community at large? And then what do you enjoy most about working on the program? Those would be more staff specific. So what are people's thoughts about those kinds of questions?
They're excellent. And actually, if I recall it correctly, through a site visit, I think that there was a program, if I'm, because of the number of people served, and they really had a hard time getting a case manager to fulfill it. And when the site visit took place, it was very evident that the person wasn't that engaged with the clients that they did have. They had very few. So I think the result of that.
So this is getting to kind of more of a standardized process. That's what we're attempting to do.
Right.
With the questions as we go into the next round of site visits.
Okay, any questions about site visits or anything?
Okay, thank you, Jason. So, we do have other matters. We've got a few announcements. Dr. Giardini wanted to inform the board of.
Okay, last week, and Mary Ann knows this, I was myself, Sheriff Caruana, his second in charge, Deputy Chief Rick Scannick. We were called before our County Board Chairman, Joe Chiarelli, and another board member, Paul Arena. They want to know our spending, how we're spending our monies, and which is a fair thing. I will say this up front, it was actually a pretty good meeting. It really was, it went well. But they want to know some of the spending and how we're doing. With the numbers that I was given, I showed them how it was and where the monies were going, and not all monies go to the programs. We know Acme and some of the insurance programs that we have to be involved with, that we have to have, is something harder. However, this has been brought up before, and they have not been satisfied with the answers, okay? So, I'm going to go before the board, county board here, within this month, and make a presentation. I want to put it to bed, so that way we don't get constantly called upon about how are we spending the monies, and what are we spending on administration. I know that there are numbers that they're saying that do not coincide with the numbers that we do have. So I want to make sure that we're on the same page. So I said I would do it annually. I'll do it biannually. I'll even do it monthly, but they're buying. We're going out after, they're buying that one. But I will do it every time and when they want to know. With this new thing that you come up with, yes, that's going to make an impact. I think it's going to be really good. I went in with numbers, you have the numbers, you have all the spending where it goes. I think that makes a great impact, in my opinion. I could be wrong. Now, if any of those who want to come with me on that board meeting, support, by all means, please come along and see how it's going to go down. I hope, like I said, I want to put this to bed. And like I said, I don't mind going before. I really don't. I think it's necessary. We do have to answer them to some degree. And so I think it is necessary that, we do present our numbers so they do see them. I think it's a fair thing. I really do. And whether it's annually or biannually, or I said, well, I don't care. I'll do it, whatever it takes to make sure that this mental health board is still in high standing. And after getting an honorable mention award, we are pretty much in high standing. So, does anybody have any questions for me about that? Like I said, the meeting was about 2 hours long. It went pretty well. We walked out with, at least in good spirits about the whole thing. Okay.
You'll let us know when you're going.
Yeah.
You'll let us know when you're going.
Yes, I will. Yes, sir, I will.
And we'll be there back.
Yeah, right.
It'll be open meeting.
It's an open meeting, correct.
Okay. Well, thank you, Terry.
Okay.
And Dr. Gorski.
Well, circling back on the behavioral health committee, the mayor and the chairman's behavioral health committee talked about that before. I mentioned it last time. So just very briefly recall that our board provided an accelerator grant to this committee for the hiring of a consultant. I mentioned it in our last month's meeting. So since that time, I was at a meeting where the consultants who had submitted proposals were winnowed from 3 to 2. After our meeting here last month, there was a meeting where the 2, which are Guidehouse and HMA, gave presentations
Mary Ann wasn't able to be there. I'm representing us with that group, and I'm sure Mary Ann will circle back into it. Long and short of it is, both organizations have national experience in the arena of doing, I would say, environmental assessments of behavioral and substance medicine treatments nationwide. So they both have broad levels of experience. Good back and forth, good presentation, but no conclusion to this meeting, which is me. Dan Ross and Dr. Martell, in charge of that committee, they had suggested that we would need to reconvene. Hopefully, Mary, you could be a part of that if that occurs, to actually make a judgment about one of the two. Both of them presumably knew what the budget of the accelerated award was. Both of them, their numbers came in within the budget. So I think it will be one of the two of them, and I'll just keep you posted as to what, or Mary Ann will, what we do. So it's theoretically, it's still moving forward.
Okay, thank you both.
Yeah.
Oh, sure.
I'm sorry. I would like some clarification from Jason and Pruitt regarding the sales tax that is currently on the ballot. Been getting a lot of questions from people as to why R1 or the board is not making public statements advocating for or against that sales tax. And so I figure since we are in an open meeting, that if there's clarification that can be provided, then maybe people will have a better understanding.
Okay, we had our attorney had sent out an advisement as to how we can participate. And so Jason, I think that would be important for the new business, to see that, to review that. But in terms of Jason's participation, R1 is not political. So they do not get involved in it. Actually, if you want to talk to someone, Mr. Woodard is involved. So.
Yes, I was aware. I just wanted to make sure that it was, the statement was made publicly so people would understand what we're saying.
Right, I appreciate that.
Our position is as board people, we can provide all the education we want, explaining to them exactly what we all heard today. So, you know, everything that this board has done. The only thing we cannot do is to encourage people to vote one way or another.
Or ask for money. Yes.
Right, or ask, so we stay within that field, we're fine.
Thank you.
Oh, Brian, the new sergeant of the CCRT team's here. Make sure we introduce yourself, okay?
Yes.
All right, Brian. That's all.
You should introduce yourself.
We're Brian Mace, I'm a sergeant with the Rockford Police Department. I've been in the police department for 22 years. Actually, just sworn me in my first day. I've been with the Community Services Unit. I was in the school unit. I was most recently in the Detective Bureau. I was just appointed to this position 2 weeks ago, so I'm still kind of learning my way around, but I'm excited to learn more and pass on some of the things that I know.
Thank you.
Thank you.
Thank you. Okay.
So, may I make a motion?
Yes. Second.
Put us all in.
All those in favor, please say aye.
Aye.
Opposed, same sign.